Everything that affects our environment affects our health. No one is going to be exempt from this, and everybody will be at risk. My name is Cindy Parker. I'm a physician. I specialize in how the environment affects health, and I'm on the faculty at Johns Hopkins Bloomberg School of Public Health. There are some populations that are especially vulnerable, and those tend to be our children, people over the age of 65, and people who have any chronic medical illnesses, things like heart or lung disease, things like diabetes. Those are the people who are the most vulnerable. And actually, that turns out to be a pretty significant part of our population. So just age-wise, the children and the people over 65, that's about 1 in every 3 Marylanders. And then people who have chronic illnesses. If you think about just kind of the 4 big ones, diabetes, heart disease, chronic obstructive pulmonary disease, a lung disease, and asthma, that ends up being something like 3 out of every 5 adults in Maryland. So we're not talking about just a small little section of our population. It actually ends up being a very large part of our population. We know that we're going to have more heat waves, and as I mentioned, they're going to be more frequent, they're going to last longer, and they'll be hotter, more severe. If we continue to produce our electricity primarily by coal-fired power plants, for example, we have seen some very good estimates of how those health effects translate into medical costs and health damage. If we switch off of the dirtiest ways, the most polluting ways to produce energy, and that's typically coal-fired power plants and some other things, and instead make our energy from clean renewable sources, that has immediate health benefits because it cleans up our air immediately. So we have far fewer of those early heart attacks or premature deaths from heart and lung disease, thousands of fewer asthma attacks. So we get immediate health benefits from cleaning up our air by switching to clean renewable electricity. And then we also get the short-term and longer-term benefits of reducing climate change as well. So all the other things that we've been talking about. So the state plan calls for a reduction in how much energy we use. It also calls for an increase in how much of our electricity is generated by clean renewable sources. Those are great things for our health.